We're starting our beginning now. How are we going to fix it? Good evening, everybody. It is Monday, and it is 7 p.m., and here we are in Newport Richey at the WeBeam TV studio, and this is our 23rd episode. It's going to be a great episode tonight. My co-hostess, Miss Nada Cerrito, what's happening? My guest, Dr. Spiegel, who you're going to hear from in just a few minutes. It's going to be a great episode. Another great 62 Who Knew guest that can make the quality of life much better. I'm going to say a quick thank you, as I always do, to our guests from last week. And we had no guests from last week. Thank you for being there. Would you thank me?
Thank you for being there.
It was a pleasure for being here. And I'm going to do a quick synopsis for our new viewers, because our audience gets bigger and bigger every week. 62 Who Knew is all about the fact that longer lifespans, something that is a blessing, but it is most certainly a mixed blessing. Longer lifespans for the generation that I'm in, the baby boomers, of which 10,000 of us a day are turning 62 years old for the next 19 years. 10,000 people a day turning 62 years old for the next 19 years. And everyone approaching retirement for the last 3 or 4 generations, our fathers, our grandfathers, their fathers, they all had the same questions as they approached retirement. Did I save enough? Should I take Social Security? Should I defer my Social Security? Should I have bought long-term care insurance? Do I want Medicare supplement policy? Do I want Medicare Part B? The questions never stop, and they're always the same. But they're a little different for our generation today, because our generation has the benefit, and that's one of the things Dr. Spiegel is going to talk about tonight, of so many incredible medical and scientific breakthroughs the last couple of decades that we're all living well into our 90s, or at least a great majority of us are living all into our 90s. So who knew at 62 years old you still had half the time? You've been here for 60 years? Guess what? If you take care of yourself, you're probably going to be here for another 30 years. And that's what 62 Who Knew is about. Every week we try and bring you a guest, whether it's financial or health-wise, to make sure that if you're going to be here for another 30 years, you better damn well have quality of life. And before I hand this over to the doctor, I want to make one more announcement. Then I'm going to do a brief biography of you, because your background is kind of vast. We got a lot of things to talk about, and the hour goes quick, doesn't it?
It does.
I mean, really and truly it does. Let me just give you, I want to make one big, huge announcement, then I want to give the background on Dr. Allan Spiegel. We've announced some great things on this show, we really have, but today's it. Today we're over the top. We have our own mugs. Is there any way we can zoom in? Look, Nada, hold up. We have 62 Who Knew mugs.
Cheers.
Cheers. 23 weeks it took me to save up for these. I bought 2 of them. No, I actually bought 8 of them. I brought John one. We have our own mugs. There's no doubt. Next step is major network TV. It was the mug. That was the missing ingredient. But on to tonight's guest. Let me tell you a little bit about Dr. Allan Spiegel. He is a renowned neurologist and nerve pain specialist, and again, one of the leading experts in the nation on hyperbaric oxygen therapy. Dr. Spiegel received his bachelor's degree from the University of Vermont and his doctor of medicine from the University of the East in Manila. While there, he studied both Western and Eastern medicines. He has also provided health care to disadvantaged patients in the surrounding area. Since 1984, Dr. Spiegel has successfully prescribed hyperbaric oxygen therapy, HBOT, for numerous pain-related conditions. He's a pioneer in his field and very innovative in these treatments to ease pain for, I would have to say, thousands of people, and especially U.S. military. I'm going to turn, there's so much more, and you know I don't like to read stuff, but I have to, I can't memorize this stuff. Welcome. Thank you for being here.
Thank you.
And we're going to talk about something special that you did for me right at the end of the show.
Okay.
But go ahead. Nada, I know we have some questions, but my first question, and then you'll take over with the question, is what happened in 1984? You're already a successful neurologist, and suddenly there's a what made you do this? Oxygen therapy.
Back around that time, actually around 3 years earlier, my mother had had a stroke. And as a neurologist, we know that, at least we tell our patients that however you are 6 months after the stroke, unfortunately, that's the way you're going to wind up being for the rest of your life. And my mother had a stroke, could not move the left arm and leg, had difficulty with speech, and she had gone through the routine physical therapy, occupational therapy, chiropractic therapy, you name the therapy, she actually did it.
Right.
And she got better to a certain point, but then she could not progress beyond that. And then she said to me, there's got to be something out there that I have not provided her. And I said, went on the internet, and of course everything that I had provided her with was the routine therapies. And then I got shut off on a tangent somewhere on the internet, and someone was discussing hyperbaric therapy. And I called up one of these facilities. I said, look, I'm a neurologist. You can't fool me. I know it can't work for this. And he said, no, come on down. I'll show you it does work. And make a long story short, he brought me down to his facility. He was treating 2 patients who, for the first visit, who could not move the left arm and leg at all, came in on a stretcher. I saw him for the first visit, the 20th visit, and the 40th visit. And make a long story short, after the 40th visit, they walked out without a cane.
Wow.
Okay. That kind of blew me away because that was totally and diametrically opposed to what I have learned in medical school.
How far apart are the visits?
Oh, it's 5 days a week for 40 treatments. So you're talking 8 weeks in that regard.
Oh, okay.
Each treatment being roughly an hour and 15 hour and 20 minutes per session. But at least for stroke, that is, depending on the disorder, the time can vary. But these patients, when I saw what happened to my own mother, I said, hold it now. I've been treating patients for so many years and have not offered it to I had not offered hyperbaric as an alternative to my patients, and I felt an obligation to bring it to them as well. And that's what got me into the field of doing hyperbaric, learning what it can do. It's an exciting field, very much so.
It's kind of amazing, isn't it? We've had so many other guests, and how many times it starts with our experts, mom and dad, 2 of our national long-term care gurus, Mr. Peter Gelbach and Mr. Mark Goldberg, both got into national long-term care and are, just legendary in that national field. But it started with taking care of their parents. It's just really is amazing, isn't it?
Absolutely.
Is mom still with us?
No, she passed on a few years back.
Oh, I'm sorry.
Thank you.
But she had quality of life after that stroke.
After that,
That gives me the chills. What a
Yep.
life. I know we have some questions. I want you, if you would, Nada, you're going to take over for a little bit here, because there's a few things I do want to talk about at the end, specifically that trip to the Mideast that you took. That to me is incredible. But Nada, you go ahead.
How does it actually work? What does it do to the body? What is it? What is the big mystery here?
Okay. The big mystery is we push a drug during hyperbaric oxygen therapy. It's called oxygen. Oxygen is something we kind of inhale and exhale every day. 21% of our environment that we inhale is oxygen. When you treat someone with hyperbaric oxygen, you're putting them on a stretcher enclosed in clear glass, breathing 100% oxygen, and you increase the pressure very slowly. So when you're breathing 100% oxygen under pressure, you increase the amount of oxygen saturates every part of the body. That's the skin, the muscles, the blood, the bone, brain, all the tissues, anywhere from 10 to 15 times more oxygen is saturating than any other part than at any time when you're breathing just room air. That turns oxygen into a drug. Oxygen drug does several things. Number one, it causes new blood vessels to go into any part of the body that's not getting good blood perfusion. It reduces swelling and inflammation. It improves the immune system. It helps lay down the framework for healing. Also, which is very topical nowadays, is it helps your body release 8 times more of the natural stem cells from your fat and bone marrow every single day. Each day we have a certain amount that's released from our storage. This increases by 8 times as much. On top of that, it's what the divers use when they get the bends.
Right.
So you've heard that the diver comes up too quickly and he has what we call air emboli in the lungs. They put him into a hyperbaric chamber and the pressure shrinks those air bubbles so they can pass through the vessels, and damage hopefully is not permanent and these people can improve. The whole theory behind hyperbaric oxygen therapy started with the diving industry, and the history of hyperbaric therapy goes back to roughly 100 years ago. So we're not talking about a newfangled therapy. This is going on and being used very, very successfully for roughly the last 100 years.
How did they do that back then?
Before we're going to take a real quick, we didn't think we were going to, but before we go to our next question, we're going to take a very quick commercial break. Probably be our only one of the show. Thank you.
One bee that loves going to the dentist. I am Dr. B.
At Dr. B Pediatric Dentistry, we understand the individuality of each child
And they also teach us how to take care of our teeth.
and offer an exceptional and gentle dental care experience for all children. With our laser procedures, we are able to provide gentler treatments and faster healing time.
Come meet Dr. B. A brutality free.
Call Dr. B's Pediatric Dentistry today.
Hi, my name is Mike Banner, and in addition to being the host of the 62 Who Knew television show, I am also the president of Professional Mortgage Alliance, where our passion is helping seniors entering retirement purchase their dream retirement home without the obligation of a monthly principal and interest payment. Please call me at 727-224-3859 or visit my website at professionalmortgagealliance.com.
Hi, my name is Lisa Marie Kennedy, your real estate expert here in the Sarasota, Lakewood Ranch, Bradenton area. I've spent years developing myself, studying the industry so I can serve you and communicate with you the best way possible in your real estate transaction. My phone number is 941-807-2054, or please visit my website at lisamariekennedy.com.
And we are back. Thank you so much. We didn't expect to take that break. We did, but it's going to be the only break we're taking because we're getting such good comments on this topic already. And before I turn it back over to Nada for our second question, Nada, not Nader because she gets mad at me. It's Nader. I still think it's Nader.
Nada.
It's Naider, right?
No.
No, okay, sorry. I think she spells it. Not only does she say it wrong,
You're going to
she
get
spells
smacked
it wrong.
upside the head
On live TV?
on live TV.
Well, our ratings will go up. We'll get more views. Yeah, we can have a blooper reel. You know, I'm ashamed to say this, but until I met you, I thought this just was for deep divers, you know, that had problems coming up too fast. I didn't know that until I walked into your office 5 years ago what a science this was, but we're going to cover a lot more of that.
I thought so just recently, too. I didn't realize that it was used for so many different conditions. Do you mind going on to tell us about what different types of conditions can be treated with it?
The commonly used and FDA-approved treatments include non-healing wounds, non-healing diabetic wounds, crush injuries after someone's had a bad injury and crushing a limb.
What do you mean? What does it do for crushing a limb? I'm confused.
Well, when you have a limb that's crushed, and you start giving back circulation, then there's a lot of breakdown in the tissue that was not given nutrition for a period of time, and there's leakage of the products from the cells, from the tissue, and this enhances new circulation to the area, reduces swelling, inflammation, which is causing back pressure and causing lack of blood perfusion to the limb.
So they actually could get enhanced use from that?
Yes.
That's incredible.
Definitely.
Yeah, that's incredible.
So I take it they use it like, I know I've seen like on Grey's Anatomy or something, they put people in after operations and stuff?
Actually, they do that. Particularly the field that uses it probably the most like that is our sports fields.
Really?
The hockey players, baseball players, those teams, they have very expensive players, and they have to get them back to work and back on the field as fast as possible.
Absolutely.
So if they get injured, such as a concussion or a shoulder injury, knee injury, etc., and they either prior to surgery, they'll try the hyperbaric therapy, or even after surgery, it'll help it heal that much faster. An example, not quite in the field of athletics, but in Hollywood and a lot of our special people in Hollywood, the actors and actresses, right. After they have their plastic surgery, a lot of the plastic surgeons there have hyperbaric chambers as well. So it helps them heal faster.
Oh, wow.
That's why they're incommunicado for such a short period of time, then they're back. And you don't see all the swelling and the scarring, so like that, because the oxygen therapy reduces the swelling, helps the body heal without the scarring.
How much faster, like percentage-wise, is it? Or does it just depend on the patient?
3 times faster.
3 times? Wow.
That's amazing.
That's awesome.
I had a patient of mine who was a ballroom dancer, and he needed foot surgery, and his podiatrist told him that he'd be off his foot for 2 months before he'd go back to ballroom dancing. And he came to my office right the day after surgery, we treated him, and he was back doing what he loves to do within 3 weeks. Wow. And his podiatrist couldn't understand, how could he heal that fast? Some hyperbaric wow.
Wow, that is awesome.
Well, I'm sorry, I interrupted you in the middle of your list. You were up to bone crushing.
Bone crushing.
Yeah.
Obviously, carbon monoxide poisoning. Also, when people receive radiation therapy for cancer, okay, the radiation, while doing a good job in killing the cancer, also injures the healthy tissue in front and behind the area where the cancer was. The way in which radiation works is it reduces it reduces the blood supply to the cancer, but it's also reducing the blood supply to the healthy tissue in front and behind and on the sides. So what oxygen therapy does, it re-oxygenates and gives better circulation to those tissues that were damaged from the radiation. We see this a lot with people who have head and neck cancer, so to speak. And after it gets treated with either surgery or with radiation, people wind up needing some dental work done, teeth extractions. Well, if they do hyperbaric, the chances of them having other side effects, downside, from having the extractions goes down dramatically than if they did not, yes. We have patients who've had, like men who've had prostate cancer, and they get treated with radiation. Unfortunately, many times patients can have some ulceration in the area where the radiation was performed, or into the bladder. So that will cause some bleeding, some poor healing, and the area may never heal. Oxygen therapy frequently will reverse we call radiation cystitis, radiation proctitis. I even had patients who've had excruciating pain following radiation therapy for prostate cancer, that the pain was so excruciating, and pain management couldn't treat the pain, narcotics didn't stop the pain, nerve blocks didn't stop the pain, 10 tubes hyperbaric therapy stopped it, never came back again.
That's amazing.
Wow.
Yeah, it's a fascinating field for nerve pain, neuralgic pain, outstandingly good.
So car accidents, like my daughter got rear-ended twice and she's having those needles put into her neck. I don't know, the blocks, I guess, is what she's having. Does that help? Can that help?
It will help reduce the swelling inflammation in the area. I've treated lots of patients with motor vehicle accidents, both with injuries such as you're saying, but also the head trauma, the concussion, post-concussion syndrome, post-traumatic headaches that come after whiplash injury. We've seen people get the dizziness associated with the head trauma. This goes back to what I do non-traditionally with hyperbaric, which is traumatic brain injury. I've treated many of our returning military servicemen and women from Iraq and Afghanistan who unfortunately were exposed to numerous IED, blasts. And there's a belief that when one is exposed to these IED blasts or the explosions, even though they may not be directly in front of the bomb, the shock waves does send emboli from the body into the head, brain, and cause little micro strokes, little teeny strokes. And that's why we see a lot of our military coming back with complaints of brain fog, headache, dizziness, confusion, unable to function in their normal daily, everyday life. The VA has treated them with various medications such as antidepressants, anti-anxiety medications, etc. And many times it does not work, and if anything, it makes these guys feel numb and dumb, and they resort to using street drugs or alcohol, which does not work well if they want to try and get a job. So many times they don't work. I've treated numerous of these men and women, and not one has not responded phenomenally well. We've had some that have gone back to college, gotten their master's degree, opened up businesses, where prior to that they were unable to function.
That's amazing.
Yeah.
That is amazing.
My poster child, we call, was a sheriff in Pasco County. We're in Pasco County now. There's a sheriff in Pasco County who in 2005 went to Fallujah, which was one of our worst battles in Iraq. And being there after a few months, an IED blast took out the front third of his brain. So
oh my gosh.
half of the frontal lobe and half of both temporal lobes were unfortunately blown away, and obviously he survived. And he was on the VA's care for 5 solid years, unable to move the left arm and leg at all, able to speak a handful of words. They did what they were able to do to help him.
Right.
They sent him to California for some therapies and elsewhere, but he never got out of the wheelchair in 5 solid years, never was able to speak more than a handful of words, could not function on his own. Someone called me and asked me if I would treat him, and I said, I'm more than happy to treat him. We do that, as a gift to them, because we think they deserve. We believe they deserve any care they can get. But I told them, his mother, I was not optimistic I was going to be able to help him. But within the first week, his speech improved by 80%.
Oh my gosh.
That's
wonderful.
By the end of
the chills.
I know, me too.
By the 4 to 5 weeks, he started moving the paralyzed left arm and leg. By the end of 8 weeks, we got him standing. He was a big guy, like 6'6", 250. Me and my tech and his mother were able to get him standing, not just holding him up, but at least on his feet. And by the end of his 4th month of treatment, he's actually walked out without a cane. 100%,
Wow.
100% strength was back, speech was back, doing excellently. We have him.
And he's in Pasco County.
Yeah, Pasco, he was. Still living in Pasco County.
That's amazing.
Yeah, he did great.
That's wonderful.
What an incredible
Yeah.
thing.
Yeah.
That
We
is
should have
really
him on the show
wonderful.
one day.
Yeah,
We should absolutely have him just to thank him for everything he went through for his
He did
country.
excellent. So so traumatic brain injury, I don't think we've had anybody who has not really improved well with any kind of head injury itself. We treat other things too. Now we're delving into what we call non-traditional therapy with hyperbaric, and that's what the biggest secrets are in medicine. Okay, we've treated patients with actually now it's on the cusp. Now after my treating these people for the last 12, 14 years, and now it's become on being acceptable. Acute hearing loss and acute vision loss. Okay, if you lose vision in your eye and you get to us within 24 to 48 hours, there's a very good chance we can give back the vision that's lost. Okay, if it's over 24 hours, if it's over 48 hours, but under 2 weeks, we can get some of it back.
What is it doing to the eye? I have to ask. What part of the eye did you lose that oxygen is then regenerating?
Well, what's happening is that the acute visual loss, such as the name of the disease is central retinal artery occlusion. So there's a blood clot, a stroke, so to speak, went to the eye, and this gives more circulation to the eye as well as other parts, which vessels will open up and at least give circulation to the area. Acute hearing loss, same thing. If you have acute hearing loss, there's a good chance that we can bring that back if it's within a few days. And if you wait longer, it'll take more treatments, but we can also improve on that. Right now, the organization which oversees hyperbaric therapy for the country, called the Undersea and Hyperbaric Association, has approved that for those two diagnoses has been added for coverage. Sometimes insurance companies want to cover it, sometimes they don't. But how could you live without your vision or your hearing if something simple could bring it back that quickly?
So it is covered by insurance at times?
Many times that one is. Okay.
How about other things like stroke and stuff like that?
Unfortunately,
Or are they still not frowning upon it?
right now stroke is not.
Okay.
Okay.
Yeah.
But
And the open wounds for the
open wounds, obviously the open wounds and non-healing wounds, diabetic wounds, their crush injuries all those are covered.
Oh, really? I didn't know
Wow,
that.
it's amazing that stroke wouldn't
Oh,
be.
I didn't
Oh,
know
no,
that.
but stroke would be. And it is ironic because it's a wound to the brain is almost like an ulcer to the brain.
Yeah.
Okay?
Yeah.
It's just the same thing. You would think if logically it should work on an extremity, why would you not expect it to work on another part of the body? And when we show it does work, they say, well, yeah, but I guess they don't want the expense of having to treat all these people in the country who've had strokes. They don't want to go out to cover those costs.
One of these days we'll put a team of doctors together just to have that conversation. We won't go there now. Is it the cost of treatment, or is it the fact they make more money if the patients stay sicker longer and keep coming back for treatments that don't work? A terrible conversation that one day we will have on 62 Who Knew with a group of doctors, maybe some insurance experts. I think that's the age-old question is, just how much are the insurance companies looking out for us?
True.
Yeah.
I can't imagine that anyone in the medical field would really try not to get someone
Well, I don't
better.
think it's the medical field.
Okay.
I think it's the insurance industry.
Okay.
That's why I want to have a panel of doctors.
Exactly. I don't think
Yeah.
the physicians. I think
No,
physicians.
never.
I think they would do whatever they can.
Oh,
Get the patients.
absolutely.
I don't think it's it. The insurance industry. That's another story.
Yeah, one of these days we're going to have a show on why there's so many great things out there. We're learning about one today, yet it's not available.
Right.
And it's available
Yeah,
in
we'd
so
like to
many
have
other parts
some-
of the world.
Would like to have some administrators from the insurance companies
They
on the
won't show
show.
up.
Yeah, I
They
know.
won't show up.
Good luck with that, right?
I want to ask one question before you go on the list. I've been, because this is my doctor also, I've been having some breathing problems the last couple of years. Never smoked in my life, but it's here. And I always have to clear my throat lately. I never thought about laying in the chamber. This can help?
It can help if you don't. If it's severe, we call it COPD or end-stage lung disease.
I don't have that.
No, you're not.
I think I have
Obviously.
restrictive
Right.
something.
Right. you obviously look very healthy. I'm sure you don't have.
The producer just said in my ear, "You're going to die." A positive man, Mr. Gaston is.
End stage lung disease it's contraindicated. Would not be recommended. But early lung disease, yes, because what you're doing is you're opening up some of the collapsed alveoli in the lungs and allowing to get better circulation in the area, clear out some of the bacteria that's being stuck in there. So in that regard, it's good and it is helpful. I have helped some people with that.
And I would have to think, just generally, it would just be healthy for me. I mean, not even, it's not like a specific, because I may look like I'm the picture of health on TV, but I'm not. No, I could see this. I didn't mean to interrupt, but sometimes it's just.
It's okay.
Yes.
How did you get into the field of neurology?
I guess an instructor was just very enlightening. It you always find somebody who piques your interest in a particular area, and I had one in school, and he piqued my interest in. Matter of fact, a lot of people in my group became neurologists, and larger than usual, because he was one of these dramatic,
larger than life guys.
Yeah, exactly, bigger than life.
Can you say his name, or is he still with us?
No, he's not still with us.
Damn.
Okay, yeah.
I keep asking this question, getting the ring.
Yeah. But
that's great to have a person, an instructor like that.
Yeah, but he instilled the love of the disease, not disease, love of treating neurological problems.
That's very cool.
Yeah.
That's very interesting. Is there other countries that use this therapy?
All over the world. Matter of fact, in many of the European countries, and even China, if you come into the emergency room with a stroke, the first thing you do is put you into hyperbaric chamber.
Really?
Wow.
Yes. But not here.
Not here.
And what's their success rate? I mean,
it helps. It's been very helpful. In the United States, there's 15 covered diagnoses. In every other country in the world, there's 65 to 75 covered diagnoses.
Now, I'm going to have to ask your opinion on why that is.
the FDA.
FDA.
Yeah.
FDA. Many years ago, diabetic wounds were not a covered service. Non-healing wounds were a covered service. It took millions and millions and millions of dollars and many thousands of journal articles to make the FDA says, okay, we're going to add non-healing diabetic wounds into the category of being accepted. And I said just recently they added the loss of vision and the loss of hearing. And that's been, people in the field like me who treat people both conventionally and non-traditionally with hyperbaric, we were doing both. We were treating them all along. This is not new to us. Brain injury. I've been treating brain injury with hyperbaric for the last 18, 19 years.
Brain injury
It's amazing that we've never heard of it or anything.
All I know is about brain injuries as a layman is that it's still the biggest mystery, and there's so little you can do, and here's something incredible that's documented, and I wouldn't even say your average guy, your educated person doesn't know about it, unless he's in your field.
Right. Well, right now, one of the big things is with the football players, the CTE, the chronic encephalopathy from the head traumas that our football players have sustained over the years. I've treated several of our prominent football players have had phenomenal results. Joe Namath even is a big proponent of hyperbaric therapy. He's promoting hyperbaric therapy for
really.
Oh yeah, for
yeah,
that's right. So. And we've had some good response with them as well.
Just only because you're talking brain injuries, and we didn't mention this one disease, but is there any connection between this and Parkinson's? I had an uncle that suffered with Parkinson's very, very badly.
I actually treated several people with early stages of Parkinson's and have done phenomenally well. There's a few people, I can't mention their names, who are prominent in the area who had early stages of Parkinson's, which I did treat with hyperbaric. And they, for personal reasons, they did not want to go on pharmaceutical agents that we commonly use. And they've done very, very well since then.
Wow.
Yeah.
Because it seems like, for a long time, Michael J. Fox was the only young person with it. But now I actually have a cousin who I think is too young to have it, and they have it. And suddenly you're reading about it coming earlier where, like I said, in the 80s, or was it the 90s, Michael J. Fox was the youngest person. Oh my God, how could he
Became
have
a major spokesman.
Yeah.
Right.
Now it seems to be happening to people younger, Parkinson's.
Right, and multiple sclerosis, I'll tell you, in England, they probably have the largest study on multiple sclerosis responding to hyperbaric therapy.
Really? My
Yes.
brother has MS,
Really?
the progressive kind.
Really. And I've treated many with very good response as well. So that,
How
there's
far, once they're past a certain point, does it still help? Or is it, you got to catch it in the beginning, or?
a lot depends on the person.
A lot depends on the person.
I mean, really, end stage, it's hard for me to tell you the problems.
What do you
again,
consider end stage, though?
wheelchair bound, total wheelchair bound, and not moving arms and legs type thing.
Oh, okay. Well, he can still move his arms and legs, and he can stand from the wheelchair to transfer himself.
Well, that's something that we could discuss later, but it's a possibility.
Definitely.
That's interesting. That's really interesting.
There's got to be so many people, not just watching us because our audience is growing, but still it's a minute little fraction of a number that could benefit from this. I mean, I feel like we got to
Absolutely.
take this show, I mean, this episode, and just blast this
Absolutely.
to everything we possibly can. To me, this is amazing. I mean, we're not going to talk about it for another 20 minutes, the miracle you performed for me. We're going to do that at the end.
Yes.
That had nothing to do with the oxygen therapy.
Right.
Although now I really want to try it and see. I mean, I feel like I'm hoarse now. I don't know if you're hearing it, but this is a good 2-3 months that I'm just, I mean, it just
You've
doesn't
been like
want
that
to
for
go.
several months
Yeah,
now.
it doesn't want to go away. And if you, a few sessions in the chamber,
Is there a certain amount of sessions that you can predict, or is it just kind of based on the individual, like on the certain type of, disease or injury?
It depends on the disorder, the magnitude of disorder, and then it is some personal as well.
Yeah.
If I have a stroke, if someone comes to me with a stroke and they have just some mild weakness of an arm or leg, I know they're going to get better, and I can be more precise. I can say, look, this is going to take a certain number of treatments, and I think you're going to get that back because mild weakness, arm or leg, the nerve tracks are still functioning. They just have to be enhanced. Okay, someone comes in with zero mobility of an arm or leg.
that's rough.
That's rough because now you're really fighting to get even a little bit back. But you know what? If you get a little bit back, it's enormous. Like I've treated newborn babies. Let's put it this way: I've treated newborn babies who've had some anoxia or lack of oxygenation to the brain. I've treated them, and they were destined to be a cerebral palsy type child. And I've treated them very early for about 20 treatments, maybe 30 treatments, and they went back to their pediatric neurologist, and they said that neurologically they were advanced beyond what they should have been.
Wow.
See, this is,
Wow, that's
gives me the chills.
amazing.
I mean, lack of oxygen to the mom. I mean, again, my
troubled
my
childbirth.
experience of this is pure 100% television, okay?
Right.
Whether it be ER or Chicago Health, I'm a layman at best. But you see some, the lack of oxygen to the mom. Oh my God, the baby had a lack of, I've been in enough hospitals. I've had enough friends with babies born. I don't remember babies being rushed into a hyperbaric chamber.
They don't do it.
This is just crazy that they don't do it.
So was that at the parent search that they
Yes.
found you, basically?
Yes. You'd be
You
surprised.
have to be an advocate.
Yeah,
you
we
have
always
to
say
be
no
an
matter what.
advocate.
I have a story of two twin boys born with a genetic disease called Leber's optic neuropathy, in which you're born with vision. At age 14, you gradually lose vision to the point where you're blind. And you don't go from vision to blind to vision. It's a one-way track. And the two twin boys were rapidly deteriorating to the point where one had no vision. The other one had no vision in one eye and like a keyhole vision amount in the other eye. That mother brought the second child, who's 3 weeks behind his brother, to see me. And I said, look, it's a genetic disease. I don't believe I can't change your genes, number one.
Right.
Number two, I don't want to guarantee, but we can try. So It's okay. I said, can't guarantee you. But anyway, long story short, he went from rapid deterioration to plateauing out, to not getting worse, to getting better, to the point where when I finished treating him, after I think he had 60 treatments, he had 20/40 vision in both eyes.
My gosh.
Corrected to 20/20 with contacts. And I have not treated him in 8 years. He's not gotten worse.
This is amazing.
Right. I send him back to his expert at Emory University, who the mother had told him that he was going to do hyperbaric, and the doctor said, don't do it, make him worse. I said, hold on, I can't make him doubly blind.
Yeah.
In 3 weeks he's going to be blind
partially
anyway.
pregnant. Yeah,
That's right.
You're not going to be twice blind.
Right. Anyway,
Pregnant or you're
so he was
amazing
amazed.
to me.
Yeah. Great.
Okay, I got to do
That's
something.
awesome.
I know this is not professional, but Sharon, my sister, if you're watching, text me what Joel has. I know this is terrible to do on TV, but I'm doing it. My brother-in-law, who I love dearly, is has a sight problem, and it's getting worse. So maybe he needs to come see you. So I have one more question before you, and then you're going to take over, actually, for the rest of the show. Is there any chance whatsoever, even if it's minuscule, with an incredible amount of oxygen, and then you add in a lot of testosterone, that I actually could come out of the chamber like Captain America?
It's possible, but
It is possible.
I thought you wanted to be Superman.
How much?
Well, I can't.
How much
That's a different planet. Captain America is science. That's possible.
How much testosterone did you say?
I need a lot to be
lot,
Captain
yes.
America, yeah. 'Cause, this all has to change to muscle. Yeah, there is, yeah.
Yeah, there is. There's always that possibility. It's a
Well,
lot.
if there's a small chance, I'm doing it.
It's a lot of testosterone, though.
Yeah, that would be a lot, yeah. I don't know if my major medical will cover that. Oh, you got it.
So do you have this, when did you get this hyperbaric chamber in your office?
I've had roughly 18 years.
Same
Wow,
one?
you were a
Same one.
pioneer.
Yeah.
Holy mackerel, that is awesome.
Yeah. I was one of the early proponents of using hyperbaric therapy on the west coast of Florida. There was someone on the east coast many years before me who was our godfather of hyperbaric for alternative. He died about 4 or 5 years ago.
Thank you for not making me ask.
His name was Neubauer.
Really?
Dr. Neubauer. He was a pioneer. He was the pioneer. He's you know how you tell the pioneers in medicine, don't you?
No.
They're the guys who have the arrows in their back.
Of course. Well,
Okay.
That's so true.
That's it.
I think that's so in a lot of things.
You can't go off script. People don't like you going off script. He did, and he had people didn't like that he went off script, but he had a lot of people who followed him, and he was one of the people you'll follow.
That's amazing.
Yeah.
Now, what is the difference, let's say, got to ask, between your 18-year-old hyperbaric chamber and maybe a young neurologist that's going to go listen to you and go, I want to do this, and buys one today? Has there been improvements? Obviously, there's been expansion in what you use it for.
Right.
But, I mean, has there been any improvements? I would think.
In the equipment-wise?
Yeah, I would think not.
Well,
I mean, it's just,
bigger. Now they're bigger. They're a little more roomier, a little bit more comfortable. But the mechanism of what you're doing is basically the same. Just make the patient more comfortable while they're just relaxing, watching TV, watching movies. That's all. Oh yeah.
How long is the session?
Anywhere from an hour and 20 minutes to nearly 2 hours.
Now, is this enclosed or is there glass? I haven't even seen it.
As I say, you're lying on a stretcher enclosed in clear glass. You see all the way around you, clear all the technicians around you, and you're watching TV through the glass and sounds piped in. Bring a movie, shove it in there outside the chamber, and watch a movie, watch TV.
I'm bringing Captain America.
Yeah. Look at the stock market and get more upset, but things like that. But
That's amazing.
Yeah.
So are you part of any kind of studies that are going on to be submitted to the FDA?
there are some studies with traumatic brain injury we are running too. Yes.
So what kind of traumatic brain injury? Is that those people that are coming back from war and stuff? Or?
Yes.
Okay, so they are doing some studies. So there could be a chance that FDA will approve this for more stuff.
Well, TRICARE, even though hyperbaric therapy is not necessarily approved for traumatic brain injury at this point, TRICARE is one that if you are deemed by your physicians, the VA, to have traumatic brain injury, they will actually cover hyperbaric for traumatic brain injury.
Right.
And I've treated many of them. They're doing phenomenal.
And that's awesome. And TRICARE is the insurance for the VAs.
Yes.
Oh, I
For
didn't-
those people
I
that
didn't
don't know that.
Yes.
I was just going to ask what's
Yes.
that?
Yes. Yeah.
That's fantastic.
Yeah, that's the type of insurance that they have.
Yeah.
So that's wonderful that they do that. That's fantastic.
I never hear Bill O'Reilly say
So I think it's fascinating hearing all these success stories. What other type of stories do you have?
Tell us about your trip to the Mideast.
Okay.
We're still good. With 15 minutes.
Okay.
But I want to hear that. That enthralled me.
Okay. Well, you just answer hers now.
Okay.
She
Yeah,
goes.
that's right. Everybody pay more attention.
There's a disease called reflex sympathetic dystrophy, or complex regional syndrome. It's a disorder that occurs if someone has, usually after trauma to a limb, to an arm or a leg or someplace like that, or post-surgical, after a surgery. For some reason, there's an area of the body that becomes swollen, inflamed. Pain is excruciating. Light touches is just like someone's touching with razor blades. They said, and it starts in one part of the body that gets injured and travels through the whole body. It's a possibility. And I remember many years treating people for that. He's diagnosing it and sending them off to pain management. When pain management doctors, they give them a lot of injections and narcotics and whatever, and they don't necessarily get a whole bunch better. Make a long story short, I found one patient who was treated for a wound care, for a non-healing wound, had this disorder. She got 100% better. I said, wow, that's coincidental. And after about 2 or 3 of these people similar like that, I called in all my old patients I used to send away, and they're doing phenomenal. So it's one of these things where I've had patients come in a wheelchair for 5 years, treat them for 20 treatments, 30 treatments, and they walk out.
That to me
Wow,
is just,
that's
it's got to give you the chills.
It is. It's
I'm going to
phenomenal.
ask you to turn a little this way, because as you've been talking, you've been going further, and a few of our viewers said we want to see more than just your side. That has to, when something like that happens, you just have to feel so warm and fuzzy all over when somebody comes into you in a wheelchair and then one day walks out. That's just
that's the electrifying part of my practice. I love neurology. I've been practicing neurology for over 30 years, 33 years. But the electrifying part of my practice is hyperbaric, because we see patients who've been told by the experts, feel you'll never, ever, ever, ever get better. Don't even think about doing anything else. You'll never get better, and we treat them and they're better.
This is just incredible.
Yeah.
That is
This is like
incredible.
one of our most fun shows.
Absolutely. It's really neat. I never
When
knew
I
about all
first
this stuff.
met you, I saw an article in one of your examination rooms that talked about a trip over to see a Saudi king or prince.
Prince.
And you cured them of their migraines.
No, it wasn't
What did you
migraine.
do?
No.
What was it?
No.
Did he give you an oil well? Was anything involved?
No. I still fill up at the gas station. But the story was a Saudi prince, his daughter, princess, attempted suicide.
Oh.
And it was probably the second time she tried, and she was unsuccessful, but came real close. So she had major brain injury. And an anoxic brain injury, as we said before. Heart stopped, they resuscitated her, she was not doing well. And in Saudi Arabia, in the United States, someone who looked like her, they would say, well, they're brain dead, therefore we shut off the ventilator. That's in the story.
Oh, wow.
In Saudi Arabia, it's the heart that is more important. The brain could be dead, but if the heart's beating, we don't shut her off. So they found out about hyperbaric therapy. They had actually called Mayo Clinic, Cleveland Clinic first, but they didn't send anybody over to take a look. But then I was requested with another neurologist to go over and examine and to treat. And eventually we did go over there, and we started treatment, and she is improving. I'm not going to say she woke up from the coma as well, but 100%, but she's continuing to improve based on hyperbaric therapy that she's getting.
Incredible.
Yes.
And she was classified brain dead?
Oh, she's brain dead.
Holy mackerel.
And now there's actual energy, there's action in the brain.
Yes.
That to me is just,
That's a neat story. It's a neat story.
How long were you over there?
For about a week.
What is it like there? I've never been to the Mideast.
Hot.
Yeah. It's a desert. Go figure.
Yeah, go figure. 128 degrees.
Oh my gosh.
128?
Yes.
Holy mackerel, that is hot.
Yeah.
So that's, well, we have approximately about 10 minutes left. I want to spend, did you have any more questions? I want to end like at about 5 to, because we're going to talk about next week's guests. But what else? Do you have any other questions?
Not right now.
All right, well,
I just like hearing the stories. I think they're fascinating.
First, I've got to thank you for being here.
Thank you,
Second, I have to, for everybody that knows me, of which there's, a small amount of the 20,000+ people that watch us know me, knows that I've been suffering with migraine headaches since I'm 12, and I am now 60, although I hate to say my age, until about 5.5 years ago when I met you, and I haven't had a migraine headache in 5.5 years.
Wow.
So we were talking about how great you are with your hyperbaric oxygen therapy. but as a neurologist, I mean, these were headaches. It always drives me crazy when somebody says, I have a migraine. What are you doing now? I'm going to work. When I have a migraine, I'm in my closet because I need darkness. I'm throwing up for 24 hours, or I'm in an emergency room with an IV. And this was 3 to 4 times a year for roughly from I was 12 years old till, I guess, 54, till I met you. And I haven't had a migraine headache in almost 6 years. Thank you very much.
Thank you. My pleasure.
That's a life
Thank you.
changer for me.
Thank you.
Because that took 2-3 days out of my life, and for those people that really suffer with real migraines, you know, if God would have come in front of me in the middle of my migraine and say, I'll give you 2 broken legs, but I'll take away the migraine, I would take the 2 broken legs, even though that would take 12 weeks to heal, rather than go through that 2-day migraine. So you were definitely a life changer for me. Can we, John? I know I gave it to you very late. No big deal if we can't. Can we throw up the doctor's website? All righty. It's behind us already.
Am
Look
I
at
in the
that.
way?
No, you're not in the way. So this is what they can see on the screen at home. As you can see, please go to the doctor's website if you suffer either for, what were mine, like complex migraines, whether they were the life killers like mine or just normal headaches. You were telling me when I was in before the holidays how many people say to you, oh, I'm much better, I still have my normal headache.
Right.
Because they think that's part of life. That's just amazing to me. But actually, again, anywhere in the Tampa Bay area, to me, if you had to get on a plane to come see this man, to do what he can do, whether it's the hyperbaric oxygen therapy or not, or just as neurology practice, got to come see this man. Also, great people in your office that we have to give a shout out to. That's a nice staff that you have.
Thank you very much.
Well, I hope you tell your brother about this. I'm going to tell my brother-in-law about this. This was really, I say this a lot in the beginning, and I didn't. You know, this is 62 who knew, you know, at its best. Quality of life, a higher quality of life. But you took it past that. I mean, people with brain injury, crushed bones, the incredible men and women coming back from Iran or Iraq or Afghanistan.
They deserve it, though.
No, oh my God.
Yeah, they deserve it.
Absolutely.
Yeah.
Everything.
Absolutely.
It's just incredible. So in the next couple of few weeks, we're going to have some great guests. We are bringing back on Mr. Mark Goldberg, which is one of the leading national long-term care insurance experts. We're bringing on some more annuity experts. We're bringing on a Social Security expert. There is going to be a tremendous amount having in 62 Who Knew. The new website is not ready yet. It is behind, but I have a meeting on that.
Tomorrow.
3 o'clock tomorrow. So we're going to get that new website up, of which I hope we will have a link, really, to this.
Thank you.
So if anybody wants to hear about it, they can go. This will be one of the things on the new website. John, about how much time do we have left? Oh, only 3 minutes. All right. Well, in that 3 minutes, do you have anything you want to report?
No.
No, am I going to do anything you want to report? Do you have doing anything locally? Anything? Okay. Well, then we're going to have an incredibly self-serving 3 minutes, which is the fun of being the host of the show. Whoop, wrong camera. This camera? This camera. Tomorrow, on Thursday, Nada and I will be at an incredible Tampa event called Game On that has been given by Mr. David Cribbs. This is the second annual Game On. We have more than 200 professional real estate agents in Tampa coming to it. Where is it? Dave and Buster's?
Dave and Buster's.
Dean and Jerry, what is it? Dave
and Buster's.
Dave, Laurel and Hardy, Dave and Buster's in Tampa, an incredible place. You wouldn't think it's an incredible place for a realtor trade show, but it is. Staggering room, gourmet food, and if you're a real estate agent and you don't have tickets to Game On, there may be a few left. It's this Thursday morning from 9 to 1. There's an incredible after party in Tampa after that. But if you're a realtor anywhere in the Tampa Bay area, the guest speakers, the vendors that are there, we will be the only mortgage company there, Professional Mortgage Alliance. Thank you very much for that, David.
That's the only one that needs to be there.
That's the only one, yes, that needs to be there. What else is happening? What are we doing on the 28th and 29th? On the 28th and 29th, I will be speaking at the Central Florida, which is Orlando, FPA, Financial Planning Association of Florida, which is one of the, if not the largest financial planning associations in Florida, where I'll be introducing Professional Mortgage Alliance's Blue Ocean strategy of bringing financial planners and financial advisors of all type actually into the mortgage business, licensing them. They already take care of their clients' financial needs in all ways, but very few financial advisors actually take care of their clients' mortgage needs for their residents, their true second homes, their vacation homes, their investment homes, apartment complexes. It's just amazing how a financial planner does not get involved most of the time with their client's largest asset, and most of the time that same largest asset can also be their largest liability. If you are interested, if you're a financial planner out there watching us, and you are interested in having a full menu of mortgage products for yourself from Fannie Mae, Freddie Mac, FHA, 30-year, 15-year, VA loans, of course. We're a VA lender, and we love taking care of our veterans. The newly restructured over the last few years, reverse mortgage to help people 62 years old and above. Here we are in Florida, in the retirement capital of the country. I've said this before, people don't believe it, but the average age of a person in Florida is roughly about 112. I think it's right. Is it right around that? Yeah.
Close.
A lot of children in Florida actually qualify for a reverse mortgage. It's amazing. It's a fantastic field. If you are a financial planner and interested in offering an entire menu of mortgage products to your past, present, and future client base, please contact me at mbanner@62whoknew.com, or you can contact me through the mortgage company at mbanner@pmanow.com. Next week, our guest is again, Mr. Mark Goldberg, a national long-term care expert. And we learned so much the first two times he was on with us. It was two of our most popular shows. And that's what we're going to be doing next week. Hopefully, we can take you and show you our new website next week. That'll be the first time we do that, I hope. Maybe the week after. So again, thank you for being my co-hostess. I know. I still got about 40 seconds left. Did I tell you about our cups? Yeah, I think I did that.
I should tell a joke.
No, really? Do you want to?
Sure, why not?
We got 30 seconds left.
No, I said, why don't you tell a joke?
I thought you said I should. I thought you know. We're not gonna do that. We'll bring G. David back, and we'll have a funny episode. Wrong camera, he said. Okay, wrong camera. Okay, we got 10 seconds left. Thank you so much for being here. Really and truly, this show just touched people's lives. Thank you. Will you come back?
Absolutely.
All righty.
Thank you.
See you next week. I'll say Happy New Year throughout the month of January. Bye.